Hello everyone, in this video we are going to be discussing about difference between the facial palsy and Bell's palsy. So losing movement in the facial muscles can be devastating and this can make it difficult for the people to smile, frown or to make other facial expressions. And it can also result in anxiety, depression and other mental health disorders. So, the facial palsy and Bell's palsy are among the leading causes of the facial paralysis symptoms, and they can occur for the different reasons and can cause the permanent or the temporary facial paralysis. So, in the end of the video, we will also make a column of the difference for both of these conditions, the facial palsy and the Bell's palsy. So, please watch the video till end. Now, here you can see the diagram explaining the facial palsy and the Bell's palsy. So first of all, this is the coronal section of the brain and here are the two motor cortices. Now this is the area where the upper motor neuron arises. So now here you can see this is the facial nerve nucleus and these are actually two in number and they are present at the level of the lower level of the pons. And now here you can see the zoomed in image of the facial nerve nucleus. It has actually two parts, all right, the upper part and the lower part. The upper part of the facial nerve nucleus gets the innervation from the ipsilateral side as well as the contralateral side of the motor cortices. And then this would give rise to the lower motor neuron and this would supply the upper half of the face. From the lower part of the facial nerve nucleus, it receives the innervation only from the contralateral side of the motor cortex and this would give the lower motor neuron to only the lower side of the face. So here we can see that when there is the upper motor neuron lesion, so what happens is that it would cause the contralateral side of the lower half of the face to paralyze. Why not the upper muscles of the face? So the reason behind it lies here that as I've told you that the upper motor neuron receives the innervation from both the sides of the motor cortices. So this thing is very important. Now here you can see that if there is contralateral side of the lower half of the face when it is paralyzed, this would result in the facial palsy. And in this condition, the eyebrow can be raised, but there is no raising of the angle of the mouth and there is loss of the nasolabial fold. And this is basically the upper motor neuron lesion. Then, if there is the lesion that is present on the lower motor neuron, so if it is a lower motor neuron lesion, so this would result in the Bell's palsy. It means that ipsilateral half of the face would be affected. Now here in this case, in the Bell's palsy, the eyebrows as well as the angle of the mouth both cannot be raised and there is also a loss of the nasolabial fold. Now let's make a column of difference between the facial palsy and Bell's palsy. So our first point is the definition. In the facial palsy, there is paralysis of the facial muscle, while in the Bell's palsy, there is only the weakness of the facial muscles. Now what are the causes? So both have the distinct causes. In the facial palsy, there can be the facial nerve injury or trauma to it, or there can be any infection or tumor. While in case of the Bell's palsy, there is no exact cause, or it may be some kind of inflammation by the reactivation of the herpes simplex virus, according to some studies. Now let's talk about the risk factors. So in case of the facial palsy, the Lyme disease can be a cause of it, the typhoid fever, GBS, tumor, or the temporal bone fracture. While in case of the Bell's palsy, preeclampsia, obesity, hypertension, diabetes, gestation, and upper respiratory tract infections, family history of the Bell's palsy. Now let's talk about the symptoms. So in case of the facial palsy, it can result in the asymmetrical face appearance and there is difficulty in chewing, swallowing and speaking. And there is also the drooping of the skin of the eyebrows, eyes, cheek and mouth. Then there is muscle spasm and the twitching and the person cannot move the muscles of the face on the paralyzed side. Now the symptoms of the Bell's palsy includes the drooping, drooling, pain that is around the jaws and behind the ears. Person can have headache or the altered taste. Then there can be changes in the tear and the saliva production. Now let's discuss about the prognosis. So the facial palsy can be alleviated with the proper treatment, but if it is left untreated, so that can be permanent. Now, in 90% of the cases, the Bell's palsy can be fully recovered and it really develops into a permanent condition. Then we have diagnosis. So, both of them can be diagnosed by the ENT evaluation, neurologic assessment, hearing test, vestibular test, CT, MRI, electrophysiologic test. Now, what are the treatment options for both of these conditions? So, it can be the high dose steroids, antiviral medications. The Botox injections can be required in some cases, the neuromuscular training, selective neurolysis, surgery, or the physiotherapy. If you enjoyed the video, do let me know in the comment box. Thank you.